I fear that the consequences could be catastrophic.
You must stay.
Welcome back to Ask Dr Hilary, Coronavirus Explained. Now, we know that in the developed world, COVID-19 has caused even world-class health systems like the NHS here in the UK to be seriously stretched in terms of the influx of thousands of patients, the lack of ventilators, and even a failure to provide enough PPE. So what happens when this coronavirus spreads to the developing world, Dr Hilary? Is there a catastrophe just waiting to happen?
Well, I very much fear that that could well happen. When you consider some of the poorer countries around the world with their populations, their very dense populations, with their poorer sanitation, their malnutrition, their very inferior ratio of doctors to population, I fear that the consequences could be catastrophic. I'm talking of countries like India and sub-Saharan Africa. I think this is of real concern. The only redeeming feature might be that their populations tend to be younger. They tend not to have so many elderly people, and that could be a saving grace to some extent. One of the reasons we think we saw such a high mortality in northern Italy was because so many of their population are aged over 80. They're the most vulnerable group. If you compare, I think that about 23% of their population is over 80, compared to, say, I think South Korea, it's just 14%. In Nigeria, I think 2%, and in Brazil, even less than that. So that might mitigate some of the consequences of COVID-19 spreading through their populations, but I very much hope that we won't see the impending catastrophe that could be coming their way.
Where in the world do you think COVID-19 could be most devastating?
I think in populations which are both under-equipped medically and where populations are very elderly. So there's no country that is going to come out of this unscathed, but where there are few doctors, where there's already malnutrition and pre-existing disease, countries with malaria, countries with poor sanitation and not enough water, I mean, it could wreak havoc there, and I think we need to keep an eye on that, because it's bad enough in developed countries, but I think other countries are certainly going to need our help.
And we've got a question here on the same topic on the hashtag Ask Dr Hilary from Joy Fox. She says, are the same treatments for the virus, drugs and equipment used around the world? The cases and death rates seem so variable.
Yes, by and large, the experts dealing with patients with COVID-19 are sharing a lot of the data and the information between one another, which is really good news. The medical and scientific fraternity don't have any political agenda. They share information because they know it's in the best interest of patients. It's one of the reasons I'm so proud of my colleagues. But we are using the same approach to dealing with the disease. First of all, keeping the patients safe, keeping them oxygenated, helping their breathing, giving them nursing support. We're trialling different medications such as hydroxychloroquine, such as dexamethasone, such as antiretrovirals that we use in HIV. These are the sort of things we're looking at. To date, there's no outstanding treatment that has shown huge benefit over anything else. And we're constantly looking at that. We've also got to look at the side effects of those treatments. A lot of people have been very enthusiastic about hydroxychloroquine, including Donald Trump, but the toxicity of that particular drug shouldn't be underestimated. You could do more harm than good with it, and we don't even know if it's effective yet, really, in controlled clinical trials. So watch this space. Ventilators are the same around the world. They ventilate the lung. They push oxygen into the lungs and into the bloodstream through artificial means. We've got ECMO machines in developed countries which do plasma exchange and oxygenate the blood artificially like a heart-lung machine. So there's no great difference in treatments around the world. What does change around the world is the number of cases and the ability of healthcare workers and resources to cope.
Ken Walker is wondering, could microwaves or UV light be used to sanitize PPE?
Well, in theory, you could irradiate certain materials and eradicate the virus that way, but it would be so difficult to sterilize them in bulk that way. Ultraviolet light, well, it might work on the surface of clothing, say a gown, but not on the inside, so that wouldn't work. Also, when you wash materials, you wash away some of the impermeable properties, so the virus can then penetrate through holes that are created through detergents. So it is not ideal to reuse or to try to sterilize PPE that's already been exposed to virus. It's much better, safer for patients and safer for healthcare workers to have non-reusable, one-use only equipment wherever possible.
Of course, and I would love them to have that within the NHS and care homes, but the sad reality is that right now many don't. So on a similar note, Steve Shorter asks, we are told that washing our hands kills the virus, so why can't the gowns worn by NHS staff be washed and recycled?
The main reason, I think, is because the gowns that we use must be impermeable to virus, so they've got to be waterproof. And the minute you start rewashing materials used for PPE gowns, then you destroy that impermeable layer and the virus can then easily penetrate. So that would give false reassurance to somebody wearing something that isn't efficient and isn't offering safety. So, you know, there's no easy way around this. We just need more PPE.
And we've got this question in from Joyce Bartle. Hello, Joyce.
My question is, does microwaving food or food packaging kill the coronavirus? Thank you.
Microwave is a form of energy which is able to warm up food and probably sterilize it against certain bacteria. But I think the virus is unpredictable. Packaging, why would you microwave packaging? Just throw the packaging away and then wash your hands. That's a much more efficient way of dealing with virus on packaging. In terms of the food itself, then the microwave would heat it to a temperature that would kill the virus anyway. Anything over 60 degrees is likely to kill the virus.
And Jack Spicer asks, I suffer from hay fever and I work in a supermarket as a key worker. I know that sneezing isn't a symptom of COVID-19, but sneezing does help spread it. If the pollen count starts to affect me too much, what is my best course of action?
No, he's quite right. Hay fever season is upon us. A lot of people are allergic not to grass pollen, which occurs later in the year, but to tree pollen, which occurs right now. Lots of trees coming out in bloom right now and people are sneezing. He's quite right that when you sneeze, you can eject droplets to some distance. And of course, you don't want that if asymptomatically you're also carrying COVID-19 in your nose and throat. So my suggestion would be that if you suffer from hay fever, that you take a non-sedating once a day antihistamine to reduce your symptoms. And if you are sneezing, whether you think you've got just hay fever or not, that you wear a mask. If you're symptomatic in any way, it's beneficial to wear a mask. And that protects other people from any sneezing, just in case you're carrying COVID-19. And take an antihistamine. That would be my advice.
I really feel for hay fever sufferers. I am one. I have the worst allergy to grass pollen. And it was a nightmarish time for it to start this year because it kicked off in full force just around the time as I think I contracted coronavirus. So I had no idea which symptom was which. And of course, Hilary, we're living in a world right now as well where you're judged for sneezing. And if you've got hay fever, it's really difficult not to. Absolutely. So the antihistamine and the nasal sprays,
yes, which we use, very small dose of steroids, not going to affect you significantly in terms of risk of COVID-19. So antihistamines and nasal sprays, which you can buy over the counter at the chemist, would be a good option.
Oh, I am dosed up. I am dosed up, believe me. Now, we're going to end today, Dr. Hilary, on a very nice note. I wanted to share this message from Tessa Friedland, who says, Dr. Hilary, I just wanted to say a huge thank you to you for all your great advice. I'm an auxiliary carer in a care home, which, as you can imagine, is very challenging and frightening right now. When I come off 12-hour night shifts, your advice always manages to calm me and make me see that no matter what, in these challenging times, we'll all make it through. Thank you, Dr. Hilary, for everything right now from the bottom of my heart.
And it means a great deal to me. I just feel as a doctor that if I can be of any assistance, particularly to you wonderful people who do such a fantastic job in care, you do this out of goodness of your heart, and you do it despite the risks that you run. So there is a lot of, it is scary at the moment. People are anxious. If you constantly listen to the news, where would we be? And I think just getting some consistency, and if I can provide some consistency and some, some balance on this, and give hope to people, because we will get through this. The human race will get through this. Most of us will only have mild to moderate symptoms, if any at all. But you are doing a wonderful job, and for you to say that to me means a huge amount, and it keeps me going. Thank you.
Tessa, thank you so much, and we will be clapping for you and all of your colleagues in care homes and working in the NHS at 8 p.m.
Too right.
Thank you so much. And look, if you want to ask a question of Dr. Hilary, we're going to be here again Monday to Thursday next week on the Sun's YouTube channel, and of course on my Talk Radio Drive Time show. There's a couple of ways that you can get in touch. If you want to send a question on any social media platform, just use the hashtag Ask Dr Hilary and you can send your videos in there. You can also go to thesun.co.uk/Dr Hilary or go to talkradio.co.uk. Thank you, Dr. Hilary. You can see from Tessa's message what a difference your advice is making. So I'm so glad that we are providing this public service throughout this crisis. And we will be back for another edition of Ask Dr. Hilary Coronavirus Explained next week.